Day 5 after getting a hair transplant in Mexico, I'm finally gonna take off the tape of my forehead and finally gonna feel refreshed after cleaning the top of my head with some soap. While you watch me go to town cleaning my head, I'm gonna tell you about the 6 most top asked questions that I've been getting after getting this transplant. Number 1, why did you decide to have a surgery? You already look pretty good the way you were. Why, thank you. Yes, I do have some killer looks. But no, in reality is that I'm self-conscious. I was self-conscious about the hair and a couple of the gaps that I had in the top of my head. Had to do the Donald Trump cone over to hide that balding spot. And I just wasn't comfortable with it. And I just decided, you know what? I got time, I got money, let's go ahead and do it. Simple answer is because I could and I wanted to feel pretty. Yeah, pretty. Question number 2, did it hurt? So honestly, it doesn't hurt when they're doing it. What hurts is the anesthesia shots. Those hurt like a mother. They really do hurt. They hurt a lot. But once you're all well and numb, it doesn't hurt. You don't feel anything. You're just there laying down for 8 to 10 hours. And then you do get headaches every so often, but it's nothing that some Advil can take away. It's fine. Question number 3, do you have to prepare before the surgery? So the only preparedness that you need to do is you need to be on some sort of medication before you go for at least a couple months. My clinic told me that the recommendation they gave is 6 months drinking finasteride. That way the hair molecules and the grafts are all going to be very healthy and they're going to be already, in better shape. What finasteride does is it blocks the DHT hormones on the top of your head that causes the hair loss. And by taking that for 6 months, it basically says that all the hair that is remaining in your head is healthy enough to be transferred over. For the most part, the hair on the back of your head is the one that's not receptive to DHT. So that's the hair that they get. They get it from the back and then they implant it on the top. That and take vitamins to make sure that you're not losing hair. Make sure you're drinking your iron, multivitamins. They recommend you exactly what you need to take, but every clinic may be different. The ones that my clinic recommended me to take are the Revita tablets. Next question, do you have to take medication for life? Well, yes and no, depending upon your doctor and your hair situation. My hair situation, I think, was really bad. So after I started taking finasteride and I started taking multivitamins, my hair got a lot better. But the moment I stopped taking those, it could be that the DHT comes back and haunts me even worse than before. And now the only hair that I'm going to have on the top of my head may be the one that I implanted. So for me, in my situation, I probably will be taking medication for the rest of my life to make sure that my head looks healthy. Some people, you just got a small bald spot or you just want to, make your hairline go a little bit lower. Just a transplant will be good enough. And, you don't need vitamins because everything you eat, you're already having all the vitamins that you need. So no need there. But in my situation, I will. And here's the last 2 questions that people keep asking over and over. Where did I go and how much did it cost? So I went to Mexico City. I went to the clinic of Dr. Enrique Orozco, and it's literally called DrEO Clinic. That's basically it. Clínica DrEO. Like I mentioned before, it's in Mexico City, and the customer service is fantastic. They do answer quickly on WhatsApp. You can, I'll tag them on this video so you can message them if you want to, so you can get an estimated of how much your needs are going to be. For me, I decided to do 3,500 grafts, which that cost about 65,000 pesos, which is more or less about $3,500. But I decided to go with a VIP route, which is an extra 20,000 pesos. So it was a grand total of 85,000 pesos, which means $4,600 for the surgery. But the VIP package includes the room stay, so I don't have to get a hotel myself. They provide it. It also includes the medications, the procedure, the vitamins, and a whole package of different drugs that you need to take to make sure